Let's now tell you that today, December 1, marks World AIDS Day, a global event to raise awareness about HIV/AIDS, support those living with the condition, and honor lives lost. Each year, a theme spotlights critical aspect of the fight against HIV/AIDS, and this year's theme, Take the Right Path, My Health, My Right, emphasizes the connection between human rights and health in combating the epidemic. The World Health Organization is urging leaders and citizens to address inequalities that hinder progress in ending AIDS. AIDS, the advanced stage of HIV, severely weakens the immune system. While it can take years to develop, early detection and advocacy remain crucial to combating the disease and achieving a world free of AIDS. And now to discuss this, we're joined by Dr. Reinnet Awoh, who is a public health physician. Dr. Awoh, good evening to you. Dr. Awoh, if you can hear me, I'd like you to switch on your visual so that we can see you, and of course your audio so that we can also hear you. We'll be waiting to talk to you about this. I guess we're going to have to come back. Okay, good evening to you, Dr. Awoh. It's nice to have you around.
Yeah, thank you very much. Thank you for having me.
You're welcome. You're welcome. So how effective has World AIDS Day been when we talk about raising awareness and reducing the stigma associated with HIV/AIDS globally?
All right. Thank you very much once again for having me. So, what is has been very instrumental actually. It has been one of the effective tools since 1988, about 3 decades ago, and it has been a platform for educating, advocating, and solidarizing with those living with HIV, creating awareness for HIV and AIDS generally. And I think it has been very effective as a tool for the purpose which it was set up by the World Health Organization. And it has been able to dispel a lot of myths around HIV and AIDS, created a lot of awareness for people. Myths such as HIV, it's a death sentence, once you contact HIV, you are going to die and all that. And also myths around contacting HIV, that you can get infected through casual contact, such as sharing of utensils, sharing and hugs, and all that. So I think generally the World AIDS Day as a commemoration day for the HIV and AIDS has been a very instrumental event. Has to an extent achieved the purpose which it was set up. Though we are not yet there, we have not yet achieved epidemic control. But I must say, so far, it has been a very effective tool in achieving the good set.
All right. So this year's theme focuses on human rights and health. So how can we address issues around inequalities if you're hoping to help accelerate the fight against HIV/AIDS?
All right. So addressing inequality is a very fundamental issue, and it's very important if we must accelerate the fight against HIV and epidemic. Inequality generally in the health sector, education, economic opportunity, it creates barriers that disproportionately affect vulnerable populations such as women, young people, key population, and those living with HIV in underprivileged regions. So, for example, a study showed that over 50% of new HIV infection occur in marginalized communities, and where access in most of these areas, as we know, health services, access to testing, access to treatment, ARVs are scarce. So we must, at all levels, try to close this gap if we must achieve epidemic control. And also when we talk about gender inequalities, as we know, women and children are the most affected in their population in the community when it comes to HIV and AIDS because of their peculiarity. So that is why this year's uh, team is focused on human rights and health generally. So if we must achieve HIV and AIDS, even in Nigeria, that's about the global team focusing on human rights and health. Whereas in Nigeria here, basically we focus on sustaining the response and stopping HIV among children, in the society. So if we must bridge this gap, these marginalized societies must, must we must take them out of their vulnerabilities and cover this gap because as we have already highlighted, most of the HIV and AIDS, it comes from these marginalized societies because of their already disadvantaged situation.
Well, we actually hope that the government and health practitioners will be able to get it right when it comes to protecting these people and providing them with the adequate health or medical needs to help them get back in shape. Dr. Reinnet Awoh, public health physician, thank you so much for sharing your thoughts with us.
All right, thank you very much.